Experts say rapid restoration of cerebral blood flow is the principal goal of ischemic stroke therapy, as it yields better clinical outcomes and reduced mortality rate after acute stroke. On this episode of Health Digest, we look at one of the most effective medical interventions ever discovered for the treatment of stroke, known as thrombectomy. Ischemic stroke is the most common type of stroke doctors say occurs when there is a blockage in one of the big blood vessels of the brain. Over the years, they have treated this type of stroke using clot-dissolving drugs. However, with advancement in research, doctors have come up with even more advanced procedures said to guarantee best outcome for this type of stroke that leverages use of a device known as solitaire, a self-expanding stent that offers the unique capabilities of being fully deployed and retrieved without having been detached, that helps in the retrieval of the clots. Solitaire device, according to experts, was being used to treat wide-based aneurysm before the breakthrough that brought to light its role in removing a clot.
7 studies started taking place from everywhere, some in North America, some in Europe, and some in Asia. And the phenomenon, when the results came out, because every clinical study, we have what is called a clinical equipoise. A clinical equipoise is a question that, does this thing actually offer value or not? The moment that disappears, when you know that it offers value, you can no longer study it. Because then you will be telling some people who you already know that it's a superior treatment to go to an inferior treatment. Right. So at that stage, you have to stop the study. You know what happened? When the first result came out, all the other 6 studies had to stop because the results were so dramatic that there was not much question as to the value of the treatment. Because this was a disease we had hardly moved the needle for 40, 50, 60 years. And suddenly you had not just this improvement of 10%, but this 6 times increase in chance, plus other many benefits, reduction in other bigger surgeries that needed to be done that were costly and left patients debilitated. So from then the phenomena moved very quickly. It started from you had to be treated within 6 hours. Then you had to be treated within, it was obvious you had benefit up to 18 hours. So a majority of patients who come in within 24 hours, regardless of even evidence of MRI that a lot of the brain is already injured, majority of them would still benefit from having this procedure done, which we can say is reperfusion. Reperfusion, i.e. restoring blood flow into an area of injured. So now look at all those combinations. Very young population, many manual laborers, increasingly bad diet, increasingly incident of strokes, and we are lucky that we are arriving at the moment when we have an effective treatment.
Thrombectomy is a procedure said to have revolutionized the treatment of ischemic stroke. It involves mechanical removal of the clot as opposed to the use of medicine. The minimal invasive procedure, also known as mechanical thrombectomy, according to experts, is used when a patient comes in with typical stroke symptoms, which include face drooping on one side, inability to keep both arms raised, and slurred speech. Some of those strokes are caused by blood clots in smaller blood vessels, while others are caused by blood clots in larger blood vessels.
A stent-assisted mechanical thrombectomy, which is a long word to say we have mechanically removed, as opposed to chemically where we would have given treatment like a chemical drug. So mechanically assisted stent thrombectomy. In this case, we are using what is the market-leading stent, which is called a solitaire. It's a what you call a non-detachable stent, because just to be clear, there are stents which sometimes we deploy permanently to open vessels. This one is attached, as you can see, so that you are able to pull it back.
Some of the devices used during the procedure include a microcatheter, a stent retriever, a guide catheter or balloon, and a distal access catheter.
Yeah, there we go.
Under X-ray guidance, doctors insert a catheter in the groin of a patient and travel all the way to the brain, where they restore the blood flow by removing the clot. During the procedure, the doctor threads a catheter using X-ray guidance into an artery. They then gently push the catheter up into the head and neck area until it reaches the blood clot. Thereafter, they insert a mesh wire device called a stent retriever into the catheter, which reaches past the clot and expands to stretch the walls of the artery to enable blood flow. They then retrieve it by pulling backwards and retrieve the clot.
We are going to pull so the ballooning to prevent clot showering. We want the whole clot to come back. We don't want to force it to go distally, so we'll have a balloon to prevent that from happening. So you inflate the balloon for me. So if you watch that, you'll see the balloon. Okay, so there's the balloon. You see that?
So now we have flow arrest.
So now there is no flow. So the clot, there's no flow in that vessel now. So the clot cannot be pushed further. We can only pull it in, because otherwise there would be continuous blood flow up to where the clot is. So at the moment with that balloon inflated, there is no more circulation in that vessel. And that has now set up the conditions for us to withdraw the clot. So we will pull the clot up to where the big catheter is and then pull everything out to come with it.
So I will release the balloon at that point.
Yes, at that point he'll release the balloon. Okay, now I'm coming back with a stent and a clot. Am I moving too fast? Okay. I will stop about there. Okay. Then I will wait for Ahmed to deflate the clot. Once he deflates the balloon, now he's going to open that, and I will migrate all of my devices, including the guide catheter, especially the cello.
Blood flow restored. Did you see it?
Yeah. And eventually we will get it out of the valve and deliver the catheter with the clot. Out.
Combined with other medical treatments, the procedure is said to reduce stroke-related disability and even death, which means better outcome for the patient.
We often expect immediate improvement in symptoms. So if a patient was weak on one side or had speech arrest, then it's quite dramatic. You do get improvements taking place right away, and they continue to improve up to a couple of days later. And as we discussed before, if you undergo this procedure and you've had this type of stroke, you have at least a 60% chance of being what we call functionally independent. That means you can walk around and do most activities of daily living and even working. But if you don't undergo this procedure, you have this exact condition, less than 10% of patients are able to do that. So it's a six-fold increase in the chance that you will end up living an independent life if we remove the clot this way.
This is an important level 1A, as per the American Stroke Association guidelines, treatment for patient who has acute ischemic stroke large vessel occlusion. So they come into the hospital mostly with hemiparesis or hemiplegia, and some of the patients immediately after this procedure, they gain again full control on 4 limbs of their body. So it reduces a lot the burden on hospitals, on having this patient on rehab and on neurology follow-up, rather than immediately getting back to being an active socially member in the society.
Recovery is not only dependent on the procedure itself. Once the doctors remove the catheters, the hole seals up within few hours. This often depends on how severe the stroke symptoms are or how severe the stroke was, and recovery in optimal case. If the procedure goes well and there is no significant brain damage, some patients can walk even the next day after a stroke.
We have a very effective treatment that takes a chance that you will be working without treatment from 10% to with the treatment to 60%. So the investment value, even for a government, it should be obvious. So we often expect immediate improvement in symptoms. So if a patient was weak on one side or had speech arrest, then it's quite dramatic. You do get improvements taking place right away, and they continue to improve up to a couple of days later. And as we discussed before, if you have undergone this procedure and you've had this type of stroke, you have at least a 60% chance of being what we call functionally independent. That means you can walk around and do most activities of daily living and even working. But if you don't undergo this procedure, you have this exact condition, less than 10% of patients are able to do that. So it's a 6-fold increase in the chance that you will end up living an independent life if we remove the clot this way.
Thrombectomy can be used to treat the most severe stroke that usually cause multiple disabilities like paralysis, blindness, or aphasia after stroke. Whereas the procedure is transforming stroke care, experts advise that when it happens, urgent diagnosis and treatment are required to lessen the damage caused by the condition. Thrombectomy procedure needs to happen within first few hours after stroke. The big delays, however, according to experts, are before a patient gets to hospital due to lack of awareness about the condition despite its modes of treatment being time sensitive. The procedure that can be as quick as 10 to 20 minutes is, however, not available for everyone who needs it. In fact, the majority of people who could have thrombectomy miss out on this treatment completely. Lack of funding, resources, and specialist staff mean that whether you can have a thrombectomy depends on when and where you have your stroke.
The number of strokes we're suffering per month, per year in this country is going up. And those patients need this treatment because if we look at the cost savings, it's going to be so much. And because of the nature of the equipment, it's really not going to be just the private sector. It has to be a public sector phenomena. And like I said, because the requirements are that the treatment is most effective at 24 hours, we cannot have a Nairobi-based treatment like we have for things you can say tumors where you have some time to travel. This has to be regional. At the very least, all former provincial centers have to have that capacity. But even better would be county centers, because you know Kenya, if you're going to say you have to access treatment within 24 hours and you're in Garbatula or Turkana or Tana River or somewhere, trying to get that person transported to a regional center will take some time. So the shorter we can make that period, the more effective and cost-effective the treatment. So all those things tell me that this will have to be a national effort, public, with obviously very robust private sector engagement. It will have to be a deliberate action, a recognition that this is an important phenomenon, just like we recognize HIV/AIDS, for example, or efforts we have to put into cancer. We will have to put an effort into this.
Stroke is the leading cause of death and disability in sub-Saharan Africa with increasing incidence. Ischemic stroke is the most common type, making up 87% of all cases. The hemorrhagic type occurs when blood vessels ruptures as a result of an aneurysm or arteriovenous malformations, an abnormal connection between veins and arteries leading to bleeding in the brain. The third type of stroke is known as transient ischemic attack, also known as mini stroke. It occurs when there is inadequate supply of blood to a part of the brain up to a few hours. Experts say certain factors can predispose one to stroke, and they include an unhealthy diet, lack of exercise, alcohol and tobacco use, genetics, age, certain medications, among other risk factors.
Prevention is always better, it's by far the cheapest treatment. And this is a multi-year disease. You don't develop a stroke because you started eating chips last week. No, obviously, and it takes a while. Yeah. You have to misbehave for a little bit, for a while. And the advice we give is what we give now. People need to be physically active. If that means exercise, it's exercise. If you're involved in a physical demanding job, that's good. We really need more natural, in fact, you can say traditional foods. They're much more wholesome in terms of calorie provision, nutrient provision, and avoidance of some of the more unhealthy things. That's for sure. It's part of the treatment, is what we discussed. And then beyond that is people should adapt healthy lifestyles in terms of choices of how they drink, for example, consumption of alcohol, cigarette smoking, and also for those ones who are already unwell, who have hypertension, diabetes, seek early treatment, effective treatment. All of those are part of that conundrum. So having done that, we're still going to suffer, unfortunately, because this habit we didn't, even if we implemented all of that in the country starting today, we still have another 20 years for, unfortunately, what we have been doing over the last 20, 30 years that we have to contend with. And that is a large number of patients who have got strokes of this type. So for those ones now is where this treatment comes in.
According to the World Health Organization, to achieve a substantial reduction in non-communicable diseases mortality, there is need to strengthen health systems in order to provide equitable and high-quality management of these diseases.
This is a real life practice with hands-on for physicians, so they get prepared on the full setup in a cath lab on how to do stent retriever procedures. So they could start working on their hospitals on having the full setup in patient triage and referrals from other hospitals, so they can start treating stroke patients in other hospitals. So we inject a fake clot into the intracranial arteries on the flow model, and then we go with the full system, full portfolio we have from Medtronic. So we have the Cello balloon guide catheter, then we introduce our aspiration catheters React 68, and then we introduce our Phenom 21 microcatheter. Then with the Solitaire X, we do stent retriever in combination with aspiration. Right now in Kenya, we have one active comprehensive stroke center, and the aim from this workshop is to have at least from one of each of the hospitals represented here in the workshop to have also stroke treatment at their facilities.
The global health body estimates that 15 million people suffer from stroke annually globally, with an additional estimated 5.8 million deaths being attributed to the condition. Thrombectomy is subject to availability, but experts say it must be available as soon as possible, 24 hours a day, 7 days a week, for everyone who needs it. Gloria Milimu, KTN News.